With so many healthcare innovations out there on the horizon, today's co-host is focused on something that impacts every single one of us. Please welcome Amanda Gravitis, the CEO of Smart Salem, to the show and to the sofa. Thanks so much indeed for being with us.
Thank you very much, Tom. It's an absolute pleasure to be here and co-hosting the show today. I'm really excited about talking about what we're seeing in the preventive health space, some of the data that's coming up around the attitudes and behaviours towards preventative health testing. I know you were talking about that a little bit earlier.
Yeah. Well, let's get into it. Let's talk one thing that connects us all. You know, it doesn't matter whether you're an ultra high net worth individual or just come to the city for the very first time. Anybody that looks to come here needs to do a medical check in order to get their visa. They need to go through the blood test. It causes a little bit of concern for many out there. But again, let's answer the why first. So what's the reasoning behind the medical checks and the blood tests in terms of the visa process?
Sure. So at Smart Salem, our purpose is to empower people, so individuals and communities, to enjoy better, healthier and longer lives. When we talk about that with respect to the visa process, the reason that the medical is important is to protect the health of the community. So it enables the government of Dubai, and we are very proud partners to be providing services on behalf of government at Smart Salem, to make sure that the residents that are living here in the UAE are healthy, that they're not going to spread any sort of communicable diseases and things. It's very sort of simple testing. It is purely administrative for most people. So you shouldn't be worried, although I know it is a daunting experience, especially being new to country. You don't know what's happening with that. But no matter how nice of an experience we make it at Smart Salem, it's a convenient inconvenience at the end of the day, because we're not actually testing that amount of sort of biomarkers and things. So we have in the last couple of years really been expanding our services on that sort of preventative health side of things, to make it easier and more accessible for people to, to actually get a general health checkup, to check their hormones, to test their intolerances, their allergies, and to make that as convenient as we make the visa testing.
Amanda, back to kind of the medical visa requirements. You spoke about convenience there, and one thing that a lot of us Dubai UAE residents find convenience is our time is very precious. Right, so we want things to be done very quickly and at speed. You are known for that. You are known for people to come in, it be convenient, quick, they're in, they're out. Why do you think that's so important to have that kind of system and process for people?
I think when you think about sort of the vision for Dubai being a smart city, having very innovative high-end services, and also just for what we expect. In Dubai, everything is ultra convenient. You know, I order groceries once I've already started cooking dinner and they arrive still in time. It's, the fuel is delivered to the car in my garage. It's ultra convenient, and people are so busy. We're all so busy. I think one of the things that then happens, and it's a topic we can talk about a bit, which is burnout and sort of how that impacts burnout. But the reason why we provide such a premium experience is our centres are lovely. It's valet parking. Once you come in, you check in. Our average processing time in centre is just 6 minutes.
Wow.
So for a renewal, if it's a new visa, you can be in and out of the centre within 10 minutes. Now, we do have robots that also serve coffee for our customers. You don't even have time to drink it, to be honest, and you're already sort of finished your test. We also deliver the medical results within just half an hour for the visa medicals. So it's the quickest sort of no waiting in and out of the centre, but also the quickest turnaround time of results. And I think that is just what we expect here in Dubai across all services.
Yeah.
It makes so much sense. I love that. It's wicked. So you were talking earlier about preventative health, and you recently spoke at the biohack, talking about biohacking and the longevity summit. Why do you think that's becoming such a big thing these days?
I think in Dubai especially, people have a little bit more disposable income. We're very health conscious sort of as a society today. We've got a little bit of we've done a bit of research around attitudes and behaviours, and 80% of people agree that you should get a health checkup even if you feel healthy. And I think that is really important, because some of the things we see are people who are completely asymptomatic, having actually potentially life-threatening conditions that are underlying that they have no idea about. And in some cases, what they're actually doing are things that they think are positive for their health, but are actually very detrimental. But 1 in 10 people have never had a health checkup.
Wow.
So 1 in 3 women have never had a hormone check, and at 45 years and above, it's 1 in 2 women. And that is it's honestly really, really alarming with some of the things that we see. And that's why when we talk about preventive health testing, getting tested is so important, because if you want to talk about biohacking, longevity, optimizing your health, you need to know your baseline.
Yes.
If you don't measure it, you can't sort of optimize it. You don't know what you should be investing in order to have the biggest impact on your health and on your lifestyle.
I get that. But I'm going to go back to the point we meant a little earlier on. I completely agree. Prevention better than cure. That has been the adage for medical science for years gone by. But there are so many routes to prevention at the moment. You know, be that online, be that tech innovation, be it your wearables, be it, as you said, going to ChatGPT, etc. There are so many tests you can take as well, and not all of them are covered by insurance, or not everyone has the insurance that covers all of them. So if you were to give us a 101 to get people started on that process, or not so much the most important, but what is a sort of entry point, a gateway, if you like?
I think the entry point in something that people should be doing regularly is just a very sort of simple but comprehensive blood test. You know, you can start looking at more advanced things that aren't covered by insurance, things like gut microbiome testing. The importance of gut health on overall health is significant, and is something that is becoming very popular to talk about at the moment. DNA testing, these can give you a huge amount of insights, and AI is really allowing these services to be more accessible. But when it comes to what should everybody be doing regularly, it really is a blood test that covers, you know, probably, I would say 50, 60 blood sort of biomarkers that test things like cardiac markers, lipid profiles, hormones. This sort of thing is a really easy thing to do. And then depending on what the results of that are, that really dictates how frequently you should be doing it. Also, family history is something to consider when we're looking at what should we each be looking for, because again, depending on our genetics, our lifestyle, the environment that we live in, all of these things impact our health. And if we want to make sort of personalized interventions to improve our health, this is how we get the information to do that.
So would you say once a year blood test, is that enough?
Depending on the results.
Depending
if something comes up in the results, you may need to test again in 3 months, 6 months time. This is very based on what the results actually are. And this is why making sure that you have a consult to talk about your results with a very qualified healthcare professional is also one of the really important things to do. This is why you can't just rely on ChatGPT to interpret your results for you, because I'm sure everyone then thinks that they're either pregnant or have cancer.
Yeah, oh gosh. I should keep
And
that in
so
mind.
what about the body composition analysis? How does that fit in?
So the body composition analysis is an amazing tool that gives you insight into, you know, the muscle that you have on your body, the fat that you have on your body, how that is performing. That has a huge impact on sort of your metabolic health, and also just for tracking progress. So if you are, you know, going to the gym, if you are doing a training program, if you are making changes, you know, the more muscle mass we have as we age in a much healthier way, and keeping that in the right places is really important. Some people are more concerned around symmetry, so they do it for sort of those purposes. But it's one of the things that you need to look at a number of things alongside each other to get the most holistic sort of view of your health and of how things are going. So by looking at this, by looking regularly at your bloods and the trends in which that are happening, by understanding your underlying genetics and what predispositions you might have, how your body responds to things like metabolizing carbs, lipids, glucose, what your intolerances are, all of these things together that you can sort of track regularly are going to help you make the best investment in your health and have the biggest impact.
Because you could potentially be taking something you think is good for you. Let's say one of these, let's say ashwagandha, something like that. And you'd be like, oh yeah, I've heard it's good, so I'm going to take some of that. But it's not actually like metabolizing with your body, because you're not doing it in the right way.
I mean, I can give you an even better example that we've seen recently in sort of one of our clinics. We had a patient come in for his visa medical, totally asymptomatic. We said, when was the last time you had a health checkup? He couldn't really remember. Thought, I don't really need to because I feel perfectly fine. But he was there, convenience. He said, fine, okay, no problem, let's do it. We needed to contact him immediately when we got his results back. So this customer, he had fatty liver disease, which was undiagnosed, that he didn't know about. He goes to the gym regularly and he takes supplements. One of the supplements that he was taking was iron, and he was essentially overdosing iron. His liver enzymes were through the roof, and within 12 months he would have started going into multi-organ failure. So this is actually the importance of preventative health is not just about keeping on track, it can actually save lives. So this customer was immediately referred to an actual liver specialist, but if he hadn't have opted in for this additional checkup, he would never have known.